All right, I'm going to go ahead and start recording on my end.
Okay, I'm going to make this go to Facebook. Okay, and I'm ready.
Okay. All right, so good to go. Looks like we got 6 people waiting, so I'll go ahead and admit them, and I'll let you go ahead and get going. Sound good?
Sounds good, thank you.
Awesome. Yep.
Okay, excellent. Welcome to everyone. Thank you for spending some time with me while we go over balance hacks and how our body maintains balance. My goal through this mini session is that it is educational. Yes, it is hosted by Naboso, so I will just briefly mention that. But again, my goal is to educate you so that you can leave this feeling a little bit more empowered. So I'm going to play this from the start. Excellent. Hopefully you can see my screen. So again, my background, if you did not tune into my session last week, I did a session on foot to core sequencing. During that session, I shared my background as a podiatrist, as a movement specialist. I've been in fitness for 20 years, and I'm also the founder of EBFA, which is an education company, and then Naboso, which is a proprioceptive insole mat and flooring company. Everything that I speak about really matches what this first slide says, is that movement is life. I truly believe this into my bones, that this is really a foundational concept to quality of life and happiness and our memory. Just every aspect is movement. I know you guys all agree with this because you are in the business of movement. And then I also believe that life is sensory. So that means that movement is going to be sensory as well. You're going to see how that ties into how we maintain balance and how you can optimize balance with your clients. Our vision at Naboso is that everyone experiences that confidence and that quality of life that comes with optimizing movement. We really are in the business of quality of life. We are, you are, everybody within fitness really is in the business of quality of life. So let's go into how our body maintains balance. There's 4 main sensory input systems on how your body maintains balance. We have our eyes, we have our ears, which when you think of the ears, you could think either sound is important to balance, but it's actually much more the inner ear or the vestibular system. When we are developing in utero, the first sensory input system to fully develop is actually your vestibular system. So that vestibular system and the inner ear is critical to how we maintain balance. Then our third input system is going to be the joints. So it's the joint capsules. It's the stretch of the joint capsules, helps to tell your body where it is, center of gravity and space. And then finally, it's going to be the skin on the bottom of the feet, but also we're going to see the skin in the palm of the hands. So if you think of these 4 input systems, if you take one away, let's say I have an inner ear infection, or maybe what you might be seeing in some of your clients is that they actually had hearing loss. So if you have a client or a loved one, or unfortunately some of us as we get older, you might start to get hearing loss in one ear. That greatly contributes to a loss of balance or a decrease in stability in these individuals. What happens is when you take away one input system, yes, obviously it throws off the balance and the stability of the body, but the body is all about survival, which means that what it's going to do is it's going to over-recruit or turn to the other 3 that remain and start over-recruiting them to make up that difference, which means that if you understand that, you can then hack the system by up-regulating one of these other input systems. And that's really where Naboso would come in, is if I start to have hearing loss in one ear, maybe I'm starting to lose my vision, or I have cataracts or something like that, and I then want to upregulate either the joints, the skin in the bottom of the feet. Okay, I'm going to do the skin on the bottom of the feet because that's easy to access, and then I'm going to put a Naboso insole under the feet. Boom, I just up-tipped that input system, and that's where we see this immediate improvement in balance in a lot of the individuals that have a loss in one of these other sensory input systems. Okay. Another great example of how you could do that, and I reference this in my lecture, is by using weight, gravity, which means weighted vests. Weighted vests are really powerful when it comes to building proprioceptive awareness for the clients who are starting to lose their sense of body awareness and kinesthetic awareness in space. Another great way to do that is with wrist weights. Wrist weights are something that are easy to use. For someone who is a true fall risk, there are now fashionable wrist weights. Bella Bangles is one, and it literally looks like jewelry, which means your clients can wear it out and not feel like they're wearing, you know, your mom's old kind of old school wrist and ankle weights. So that's a huge advancement when it comes to movement disorders, balance, and sensory input. Okay, so other thing that you can use with these is if you know that these are the sensory input systems, like I said, you can upregulate them. If someone is losing their balance, cue them, teach them how to actually stare at something, spot at something, take in the room, and actually centralize their visual acuity to help improve their balance. We already spoke about the feet, but why I love the feet so much is that there's very special nerves in the feet. Nerves that help to play a critical role in balance and stabilization. My session that is coming up in the next couple of weeks through DCAC is going to be centered around brain balance link. So it's taking what I'm speaking now and going even further. I'm speaking for 90 minutes about this topic. This is your tease. So in that session, just to kind of hook you, I reference how the skin in the bottom of the feet, 80% of the nerves, the mechanoceptors in the bottom of the feet, are sensitive to vibration. Vibration helps to tell your body, your brain, how to maintain balance when we walk. Super important, which is why I love barefoot training so much, because you get the cushion of the shoe out of the way to stimulate and upregulate your nervous system. So speaking of the nervous system, this is something that is called a homunculus. This homunculus is essentially your sensory brain map. So the sensory brain map connects to your somatosensory cortex in the neocortex. And when sensory comes in, motor goes out. The more sensory that comes in, obviously, the better the motor that goes out. If we look at our homunculus, you can see that he/she has big old hands, big feet, and a big mouth. So that means that those are the most sensory sensitive areas in the body. Those that relate to movement, and to a majority of us that are listening, are going to be more so your hands and your feet. Okay, the hands and the feet, that means that those are sensory rich and sensory sensitive. And the reason why that they're so important is that the special nerves that I go into in my session, this is a total tease for you to sign in and tune into my session, is that the nerves in the hands and the feet are sensitive to 2-point discrimination. That's what Naboso is, 2-point discrimination. But it's also sensitive to the vibration that I referenced, and it's sensitive to skin stretch. These nerves of your hands and your feet blend into the myofascial web of your entire body. So there's a deep connection through hands, feet, and your entire fascial web. Something cool to appreciate, and of course I go into that much more. So let's go into how we can improve balance by understanding this concept. Okay, your first balance strategy. Let's say you are teaching a class, or you're doing a one-on-one session, whether it's virtual, it's in person, it's a small group, it's a class, whatever it is, you are teaching and wanting to improve your clients' or athletes' balance, which means You always want to think about how can I help them slash their nervous system win? This is huge. This is why I could go on and on about unstable surfaces and how we want to question why we are using certain modalities at certain points in our programming. Are they actually helping the nervous system in the way that they should be? That if you have a client who has compromised balance, they're 75 years old and they had a stroke, or they're 80 years old and they just had a fall and they're coming to you to maintain their baseline of function, let's say, or they're an athlete who had a concussion. This applies to everybody. They sprained their ankle. You are a 35-year-old young, healthy female who sprained your ankle, unfortunately teaching step class or something, right? So now we have to improve your balance, okay? You had a disruption in your nervous system. So if you're doing a balance exercise, you're standing on one leg, balance strategy 1 is to focus your eyes. Yes, I know you know this, but let's go into a little bit more. If you focus your eyes on something, kind of like how a dancer would spot, you want to teach them to not just look at something, but look at something. This means stare it down, take it in. You are zoned in. You are like that dancer spotting when she's doing a pirouette. That is going to help them filter out a lot of the noise or distraction of their peripheral vision, which is initially starting to add to some of that loss of balance or poor control of center of gravity and body awareness. Okay, by centering on something, they can also center on themselves. They can feel themselves. You will see that the more that you focus on building body awareness, kinesthetic awareness, interoceptive awareness on a client, it helps with their balance and stabilization, really their sense of self. So you're staring at something. Now that is different than a balance strategy. Once they've established that, a balance advancement strategy that is an eye movement or an eye exercise is, can they stare down at something while balancing and now start to expand their peripheral vision? So if I were doing that, I'm staring at this flower that's in front of me, but I see the Naboso boxes here. I see my water bottle to the left. So I'm starting to take in what's in my environment to broaden my peripheral vision. One big thing that contributes to fall with age is that a lot of us start to narrow our visual field. And if your visual field is very narrow, then that can greatly contribute to fall risk. I'm not saying when you spot something to narrow your visual field. I'm just initially doing it as a hack to have them center and just kind of find that point. Then when they have that mastered, start to broaden their visual fields. Okay, I hope that that's clear, that it's kind of multi-layered on how we want to do that. Peripheral vision training is huge for really everyone. As we age, that's one of the most important kind of indicators of visual strength, would be that peripheral vision. Now, your second balance hack is going to be using the skin, technically the skin of the hand, but you can also say the skin on the bottom of the feet. This means that if you have compromised balance and you're trying to balance in thick, squishy shoes, get them out of their shoes, get them barefoot. If they need to be in their socks, that's a barrier also. So get them completely barefoot to feel the ground. Now, if you are on, you get them out of their shoes and now you're thinking, okay, what is the surface that they're on? If I just took them out of their thick cushioned shoes and now they're in like a Eric's pad or like a big mattress, I might as well have kept their shoes on, because that is further disconnecting their sensory system. So I would want them on a hard surface. I want them on a hardwood floor. If they are in their home, they're going into the kitchen so that there's like a tile. I know tile, we're not doing dynamic things because you don't want them to hurt themselves. Or if they have a home that is carpeted, which a lot of people do, you need them to find the room to do their virtual balance session on a carpet that is the hardest, almost like outdoor carpet, right? Or, you know, that high traffic carpet. You don't want them in their living room or in their bedroom with thick, squishy carpet. It is going to create a sensory disconnect. Okay. Now, if you want to add in a Naboso mat, it's very specific. It's stimulating the nerves in the bottom of the feet with the pyramids. That is going to hack their balance. So technically, anything that has a texture is going to hack their balance because the nerves in the bottom of the feet are sensitive to texture. Do they have a vibration platform like a power plate? That's a balance hack, right? If you trigger point release the feet for 5 minutes before they do their balance exercises, that will increase their balance. So release, use a golf ball, lacrosse ball, trigger point ball, I don't care what you use, but release the bottom of the feet. And research has shown that 5 minutes will upregulate and improve their balance. Total hack, but we're going through the neuroscience, okay? Now, other ideas when it comes to skin would be the hands now. So the hands, they can touch something. They could just bring their fingers together. The nerves that are stimulated in the hand that improve balance by stimulating the brain are actually primarily in the fingertips. So I know that you might have said, okay, hold something. It's not that what I'm holding is touching the palm of my hand, it's actually the fingers. So whether I hold my phone like this versus right all the way that is touching my palm, this is actually what's stimulating, right? It's the fingertips, which means you can put your fingers together. You don't have to do this, fingers together. This is improving my balance. Right? If I had something in my hand, it's lightly. If I'm standing and I want to touch the table, I lightly touch it. I don't grab it. I could lightly touch the wall. You're stimulating the nerves of the fingertips. Okay. Remember, they're sensitive to vibration, they're sensitive to texture, and they're sensitive to skin stretch, which means the way that my mind goes is I want you to hold a ball that vibrates like a hypersphere. The hypersphere ball, I would want my client to hold that. If I don't have that, but I have a Naboso insole, just hold the Naboso insole, right? Make it that way if you want, right? Something that's stimulating it. I want you to hold something that is tacky, something made of silicone, because now the silicone is a little bit adherent to the skin and it creates some of that skin stretch. That's the direction that I would go. Hard ball versus soft ball. Hard balls, hard surfaces, hard anything stimulates your nervous system more than something that is soft, squishy, pillow, mattress. Okay? Excellent. Great. Here we go. Next balance hack is to use tension. It is not to do handstands, although that's definitely a fun hack to do. It is to use tension. So this means to create an engagement of the muscle. When you engage your core, that creates tension. And if you don't believe me, just engage your core right now. I feel tension in my TVA. Yes, if you make a fist, technically that's tension. If your arms are extended out and I want to add tension, I'm going to imagine someone's pulling my arms to the opposite wall. I'm giving an isometric contraction down my arm and I feel tension. That's going to improve your balance. So what I often say in my classes is that if you're touching your hands like this and we want to, kind of uptick it a little bit, just push your hands together. I just added tension. Or I'll actually coordinate it that if we're doing, let's say, a head turn, and I'm going to have you guys do this in a second. If I'm doing a head turn, every time I turn my head, I'm going to squeeze my fist a little bit harder. So I'm going to turn my head from the right to the center. And as I do that, I'm engaging my fist. Technically, I'm engaging my core because when I engage my fist, my core engages, right? And I'm going to exhale. So you're trying to coordinate all of those to improve balance. Okay. Short foot, which I spoke about in my first session with DCAC, which I speak about all the time, and I will be speaking about it in my next session. Short foot, where you push your toes into the floor, is creating tension in your foot. It is a balance hack. Okay. Now, the more areas or the more tension you can get involved, the more stability you will have. Your fourth and final balance hack is going to be to breathe. Never ever do you want to hold your breath. So as you're turning your head, as you're doing the squat, as maybe you're just standing there statically in a single leg, relax the breath. Either relax the breath or emphasize the exhale to increase your tension. Two ways that you can use it, okay? Now, I often will incorporate that if you shut your eyes, you want to actually really relax that breast. You don't want to try to like lock down. Remember that we are not, you don't want to be the flagpole, you want to be the tree. So trees oftentimes, depending on how severe it is, oftentimes do not blow over because they sway, right? A tree is not totally static, it's swaying. That's how we want our body as well. So having some movement is actually fine. Like, can you relax into this instability versus trying to lock down every muscle and be like a flagpole? Okay, so let's put a few of these to the test because we have 10 more minutes in this little lecture series. So I want you to stand up with me, please. And if you don't want to stand up, you totally don't have to. You can do this via osmosis or something. Okay, here we go. Vicariously, you're going to vicariously do this. All right, so what I want you to do is when I teach someone to do balance is you could be in a variety of bases of support. And I know you can't see my feet, but I'm going from a wide base of support to a narrow base of support. Now my feet are touching, to a tandem. So I have one foot in front of the other, and then to a kickstand, which my toes are touching the floor, but my foot is down, and then all the way to a single leg stance. Yeah, that's how you want to kind of progress those. Okay, now you can choose any of those, and we're going to play around with them a little bit on how I incorporate this. So if you go into a full single leg stance, maybe that's your choice. I want you to compare what your balance is like if you are standing on one leg, keep your hands relaxed, don't touch anything, and now you're just kind of like, just look around the room, like look at me, maybe look down there, look over there, right? Just kind of look around the room, okay, right? Okay, as you're doing that, right, I'm having you turn your head, I'm having you turn your eyes, and we're not stimulating anything but being on your feet. Now, as you're doing that, the more that you turn your head, you probably felt that your foot was doing this, right? Did your foot and ankle start to wobble, 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 wobble? What was happening is that you turning your head and your eyes and looking around the room, you were essentially taking away the visual slash vestibular. You were challenging those input systems. So what happens is your proprioceptive joint capsules started to move more to upregulate and pull information in. This is normal. So if your client is standing, they're like, I suck at balancing because every time I do something, my foot is like this. No, that's fine. That is your body protecting yourself and pulling in sensory information. This is important. This is necessary. Okay. So now let's do that again. So just stand on your one leg again, right? We have our hands, and let's say you're just turning your head. You can just turn from left to right, your head. Okay. Now, what I want you to see is what happens if you stimulate your hands while you're doing that, just your fingertips, right? As you do that, does that bring a sense of stability? Or if I lightly touch the wall, right? Does that bring a little bit, that totally helps, right? Does that bring a sense of stability? Maybe if I make a fist, does that help? If I connect my toes into the ground, does that help? Okay, so just play a little bit with it so you can explore it and appreciate it, but your client does as well. Okay, now another one I want you to try, and you can go on the other side as well so we're not exhausting one leg, is when you turn your head, every time you turn your head, I want you to exhale as you come back to the center. So if I'm looking one way, I'm going to shh back to the center, right? Inhale as I look to the right, shh, right? So now I'm coordinating breath, which technically coordinates tension. So give it a little go and just see how you're doing. Again, you could just be, statically. But if I turn my head and I exhale and I really emphasize the return, exhale, right? Exhale. As I'm doing it, I can't help it, but I'm engaging my abs more. I'm engaging my abs more, okay? You could do the same thing as you bring back, exhale, engage your abs, make a fist, right? Make a fist as you bring your head back. You are now incorporating these hacks to improve balance, okay? The last one that I'm gonna have you try has to do with the visual acuity. So if you're having your client either turn their head, or maybe they're doing something, you know, where they're moving and that it throws off their balance, is every time they step, they spot something. They spot something. So let's just do it with the head turn for the sake of virtual ease. Is as you turn your head, I want you to stare at something. So I'm turning my head to the right and I'm staring at the corner of the mirror, okay? And then when I turn to the left, I'm staring at the edge of the door frame, right? So you're spotting, just like a dancer does every time I turn. So I'm turning and I'm spotting. Turning, spot camera. Turn, spot door frame. Camera, mirror, right? So there's intent behind every action that I'm doing from a balance perspective. Okay, now I know that these are just a few exercises that happen to involve just head turns, and balance is very different. I could be doing an agility ladder, I could be stepping up, I could be stepping down. So you can use all of these with all of those balance exercises. A balance exercise is not just standing on one leg in one place and turning your head. I totally know that, okay? So if you have your client doing any exercise, please just remember how you could incorporate these, okay? Now, the last thing that I want to go into, and I want to take some questions, sorry, I became a little long-winded, is thinking about stacking the tension, stacking the sensory, and having that be the foundation. Remember that you want the nervous system to win when you are doing this, okay? So you have your eyes, you have your joints, you have the skin on the bottom of the feet, you have your joint capsules, you can use kinesiology tape, you could use weighted vests, you can use weighted wrist weights, you can use Naboso, the insoles and the mats, you can use cueing, light, sound, vestibular, all of that stimulates. Doing stuff in the water improves their body awareness. So I love doing body awareness exercises in the pool, okay? Now, last thing, which I forgot, sorry, last thing is that our kinesthetic awareness of our feet is really important. So I like to do balance exercises in a mirror. If your client or yourself can do this, so this would be an example of it, is I'm facing a mirror and I have a step. So I need to build foot awareness. Many people don't have foot awareness, which is again, a huge thing that we're trying to do with the Naboso insoles, is to build foot awareness. So everybody, or a lot of people, are kind of walking and they just don't really know where their foot is in space. So if you had them accidentally step off of a curb the wrong way, they don't know where their foot is in space to correctly correct that fast enough. Hence the ankle sprains or fractures. So if I have a step and they're looking in a mirror, they're not going to look at the step and step on it. They're going to look in the mirror, see the step, see their feet, place their foot on the step by seeing it in the mirror. So one, they get the visual cue, they get the sensory cue because they're hitting the step. And then of course they're getting the muscle engagement to match that, right? They might match it with an auditory as well. So doing movements, balance exercises, step ups that build kinesthetic awareness, looking in a mirror, not at their foot, they start to connect this kinesthetic awareness. I use that a ton for my neuropathy patients, for anyone who has foot drop, that's really important, really for any ankle sprain, for anyone who's trying to build that kinesthetic awareness. You do want to think of how you could intelligently use a mirror. Okay. All right. So as we wrap up, just real quick, I want to show a slide that has the Naboso products so that you are familiar with them. Head to naboso.com and you can check out all of the insoles and the mats. We do have a special discount for DCAC. Just use that code DCAC when you check out. That's going to give you 25% off our site. Okay. That is through the end of August. I'm happy to take any questions that you might have. I know we only have a couple minutes left. I was a little chatty patty this morning and I do apologize for that, but please do let me know if you have any questions, and I believe you can type them in. Okay. I'll just wait another minute so you can kind of process. I know sometimes you hear it and it's processing, and then the question comes and you're like, wait, I'm still processing. So don't worry, you can totally still process and take your time. You can take a minute and think about it. Okay, you are so welcome, Amy. Great. I have another trade show break that I'm doing tomorrow as well. I'm drawing a blank on it, but please tune in with me at the same time. I again try to make them all educational. All right, so Timothy has a question related to a neuroma that he has on his foot. And my guess is that maybe that's making it difficult for him to be barefoot when he's doing exercises. So let's go with that. Let's say that you have a client who has plantar fasciitis or neuroma or something, fat pad atrophy, that makes it difficult for them to be barefoot. Now, what I do for this is there's padding and strappings that you can do. I know this might be going in a direction that you are like, what? But putting a pad for the neuroma, Timothy, specifically, you can put what's called a metatarsal pad on the bottom of the foot, and it pops up the metatarsal so that you're not stuck on the ball of the foot and putting excess weight. And then what happens is that you take the pressure off. You can still be barefoot, but now we're balancing some of the forces and pressure in the foot. That's what my go-to is, so that really everybody should be able to get some sort of sensory stimulation barefoot. If they completely refuse to do it barefoot and they just want to balance in their shoes, I know I keep saying it, and it is a little bit biased because I'm the founder of Naboso, but that's really where it goes to. If the reality is not to do barefoot training, I get it. There are certain situations. So how can we make it their reality? How do we modify things to help them fit it into their life? If it's putting Naboso insoles in their shoes, then great. They're in their shoes, they feel safe and comfortable, but we know they're getting important sensory stimulation, right? And then we turn to the rest of the other hacks. Use the ears, use the joints, the skin, kinesiology tape, cue the eyes, right? Bring in vibrations. There's all these other ways that we can kind of incorporate that. Okay, great question, great question. All right. If there are no more questions, now is your time to type those in fast. Otherwise, I want to allow you enough break before your next session. Grab your lunch, hydrate. Excellent. Thank you guys so much. I really appreciate you spending the last 30 minutes with me, or however long you were tuning in. And I will see you tomorrow at tomorrow's session. It'll be educational as well. Again, I apologize, I don't know that session, but do tune in. It'll be same time. We'll get you educated on that as well. And then my session for DCAC, my next session. Okay, thank you guys all so much.